Welcome to Hersing University NU 640 Introduction to Women's Health Across the Lifespan. This video will discuss Chapter 3, the Health History from your Holland and Secor textbook. This discussion will serve as a brief overview of the material. Therefore, I would like to ask that you please read the chapter for additional and required information. Additionally, I would like for you to review all other required and supplemental resources. This PowerPoint will also be narrated by Dr. Alicia Sutton.
To begin, let's review what sexual health is. According to your Sarkio and Secor texts, sexual health is defined as the integration of somatic, emotional, intellectual, and social aspects of sexual beings in ways that are positively enriching and that enhance personality, communication, and love. The definition is holistic, including sexual thoughts, experiences, and values about being male or female. The three key elements of sexual health include a capacity to enjoy and control sexual and reproductive behavior in accordance with a personal and social ethic, freedom from fear, shame, guilt, false beliefs, and other psychological factors that inhibit sexual response and impair sexual relationships. The third is freedom from organic disorders, diseases, and deficiencies that interfere with sexual and reproductive functions. The sexual assessment must include a physiologic, psychological, and sociocultural evaluation, as well as elements that focus on age-related issues. Toddler and preschool children are able to identify themselves as I'm a girl or I'm a boy, but they cannot integrate gender identity into their self-concept until they are 3 or 4 years of age, when they're able to understand that gender is a permanent condition. School-age children continue to have a high level of curiosity about sexuality, their bodies, and their environment. Adolescents experience sexual awareness and changes in sexual feelings. Early adulthood is a critical period during which development tasks include achieving maturity in a sexual role and in the relationship tasks, whereas middle adulthood brings expanded sexual freedom and major physiologic changes. With that information, let's discuss the gynecologic health history. The GYN history elicits significant details that provide the essential background for the problem-oriented encounter, as well as for health maintenance visits for a well woman. The menstrual history is usually the first topic in the GYN history and should cover the following information: age at onset of menarche, date of last normal menstrual period, including the cycle length, duration of flow, and the amount of flow, and of course inquire about any irregular bleeding. If the patient is menopausal, then you will need to discuss any use of hormone replacement therapy, postmenopausal symptoms, or bleeding. In regards to the OB history, begin by asking the woman the total number of times she's been pregnant. This is gravida. Then ask her to describe each pregnancy in chronologic order. You will need to be able to document effectively the number of pregnancies the patient has had, followed by the number of live births, which is T or P, and the number of spontaneous or therapeutic abortions, which is A. Lastly, L is the number of living children. Providers will record this information using a Gravida Parasystem in the GTPAL 5-digit numeric summary. In addition, you will want to obtain the specifics for each delivery. Was the infant born at term or prematurely, and what route? Were there any complications either during the pregnancy or during the birth? If gravida is 0, you will want to determine if this is by choice or if there is a history of infertility. Now here comes the information that makes many people uneasy. Only a small percentage of primary care providers actually elicit sexual histories. There are many potential barriers to sexual history taking, including embarrassment, inadequate training, time constraints, and a belief that a sexual history is not relevant. You can obtain this information at any time during the interview. If the chief complaint involves genitourinary symptoms, include questions about sexual health as part of expanding and clarifying the patient's story. You can ask these questions as part of the OB/GYN section of the past medical history. You can bring them into discussions about health maintenance, along with diet, exercise, and screening tests, or as part of the lifestyle issues or important relationships covered in the personal and social history. Or, in a comprehensive history, you can ask about sexual practices during the review of systems. Do not forget this area of inquiry just because the patient is elderly or has a disability or a chronic illness. Asking questions about sexual behavior can be life-saving. Sexual behaviors determine risks for pregnancy, sexually transmitted infections, and AIDS. Good interviewing helps prevent or reduce these risks. Sexual practices may be directly related to the patient's symptoms and integral to both diagnosis and treatment. Ask which type of infections, if any, the woman has had, which treatment she's received, how frequently each infection has occurred, and what, if any, complications have occurred. Ask the woman the number of sexual partners she has at present and has had during her lifetime. Inquire if she is sexually active with persons who present high risk for HIV or whether she uses condoms. Include information on minor procedures, such as an endometrial biopsy and laparoscopic examinations. The information needed includes the year in which the procedure was performed, the indication necessitating the surgery, significant complications, and the outcome. Inquire about urologic health as well. Topics include the occurrence and frequency of bladder infections, renal infections, incontinence, or other abnormal symptoms. What is the patient's history of abnormal paps? Determine whether the woman has had previous cervical cytology screenings. If so, find out the approximate date of the last exam and if the results were normal. For a woman who has had an abnormal cervical cancer screening result, ask what follow-up occurred and whether subsequent screening results have been normal. Always discuss the patient's current method of birth control. All women require individualized counseling on the risks and benefits of contraceptive options and of pregnancy throughout their reproductive years, as their needs may change over time. Some questions that you may ask is, are you satisfied with the method chosen? Or, are there any questions about the options available? Closure of the health history should include offering the woman the chance to add comments or ask questions. One approach is simply to say, I have finished my questions about your health. Is there anything I have omitted or not covered, or that you would like to add to help me better understand your health or your problem today?